Right. So I hear you, Joe, right? You're talking about the communication piece, talking about the support piece, right? I really wanted to anchor this to look, if I'm at my workplace, how do I even communicate this to my fellow colleague or my superior or my staff who's reporting to me? Because he says, then you're not well, and you're not well at work. How can you command our respect to lead our team? Or then you're not well. How can you come to class and deliver the lessons? Or then you're not well. I don't want to sit beside you because you might just... What happens? So this idea of communication is important. And if I am going through some form of stress or even difficulties or challenges, how do I, even start that conversation with anyone? I mean, I feel very lonely in this journey, right? Yeah.
Yeah, I agree with you, Daniel. Communication is very important, and it's supposed to be two-way. Like earlier on, you were asking Joe, like, how to handle. And it's unless the person is like able to recognize that he is like almost drowning or sinking, then he'll be able to approach Joe, and whether he's ready to get help or speak up about his problem. If not, Joe wouldn't know that he's struggling.
Right.
Yeah.
This is the thing. So, like, back to this, all this, like, employee assistance program, all these are very important. You need to raise a lot of awareness, maybe, through everybody. Everybody comes together because, like, mental health is everyone's business. Let's come together to educate them. At least everybody know how to look out for the warning sign and they start speaking. And having said that, when there's a communication, they need to have a safe space.
Right.
So are we making them feel safe to talk about that?
Yeah.
So it's back to the employers. Are they ready to embrace all this with an open mind? And of course, there are some employers start telling us, saying that, hey, I don't have the budget, for EAP. Many a time, I don't have the budget. So what can I do? So I propose for them to work with a mental health agency. You can approach any mental health agency and we are ready to work with you. You don't have to purposely, fork out some money or whatever. We have all the expertise. We are ready to work with you to provide some advice on how you can set up at least like a basic support for your staff.
Right.
Yeah. And then or work out something, a project or something or protocol, SOP to support your staff.
Yeah.
Yeah.
I totally hear you, right?
Yeah.
But I need to take a sip of water as well.
Go ahead.
Could I just add to that?
Yeah.
I think for the Wellbeing Champions Network, we have been talking to so many companies now for the past 9 months since we launched in November of 2023. And we've been engaging the champions in the organizations themselves. I mean, these are the leaders in the organization who are driving positive change and influence in terms of mental health and well-being initiatives in their respective organizations, right? And they could either be from human resources or they can be from employee health and safety, right, depending on the organization. Well, it's heartening to know that a number of them are trying to take positive steps forward. So, for example, we've been holding a number of workshops called PeerForward, right? It's a free and complimentary workshop that we opened up to our champion members. Great participation, and a lot of them indicated in their registration for the event that they have plans to set up a peer support network within the next 6 months.
Great.
So that's an early indication that they're starting to think critically about it. But the question always comes back to say, okay, where do we start? What do we do first? Equip me first. So it always starts back with them. They don't know where to start, right? So it's not just about training a couple of people, putting them together in the group, and then saying, here you go. This is a peer support network. You got to think from a champion perspective. Putting and developing all the necessary governance and structures and all those kinds of stuff. Right? Because peer supporters, they fulfill that role. They don't fulfill a counseling role. Now, on the subject of employee assistance programs or EAP, whenever that's mentioned, it's usually mentioned in the context of providing access to counseling or therapy support that the organization has provided as employee benefit, right, from a benefits perspective to the employee. And of course, through our interviews with the champions, right, we realized that if an organization do have an employee assistance program, the follow-up question with respect to the level of utilization tends to be quite low. So utilization of EAP is quite low. And it's not a mystery as to why the utilization is low. It's coming back to the first 2 points that we addressed at the start of the show, right? Stigma and the lack of awareness that they need help, right? But the other part of the story here is the services of the EAP. The EAP essentially currently, in its very small, closed definition at its current point of time, it's expanding, of course, now. It's very much providing access to counseling and therapy, right? And automatically when you think that, the perception is that that's on the distress end of the scale. So if you don't have distress, if you just have, some coping difficulties, that's brought on by workplace stressors. So workplace stressors, the Workplace Safety and Health Council have a fantastic tool called iWorkHealth, and it identifies 9 workplace stress drivers, right? If it's workplace stress, then it's like, okay, everybody goes through this. I don't really need counseling. And so we ask us, okay, it's fantastic then that, why is it that people are struggling to understand the level of utilization of EAP being low? Because the distance from fostering self-seeking behaviors to the nearest help is a counselor, that may seem like too big of a gap.
All right. I'll pick on that, right? So what I'm hearing from both really is, on Porsche's side, I'm hearing the environmental space, the office itself, the employers need to set aside a certain commitment to say, we want to talk about the budget, we want to talk about having a safe space in the organization to have such conversations. From Joe, I'm hearing a lot about a platform, a support system, a network system, and also looking at the preventive side of things as compared to at the distress level where we have interventions in place.
Yeah, the whole way through.
And to the organizations, right? No, I'm not going to look at the camera, but I'm just going to tell them that, look, for organizations, I think there must be a reason why you set up a well-being strategy or a process to do this, because I think it's important to not only just lip service, but also put in a committed resources, platforms, support systems in place, right? Because I want to address this idea of support, right? Because what is enough? What is not good enough? What is just doing the basics? Where do we even start, right? The magic question for both is where do we even start?
I think here, we started with talking about COVID,
Yeah.
right? And post-COVID, pre-COVID and post-COVID. So I think right now, since there's a lot of talk, there's various statistics and surveys can be cited that says that, okay, there's an increased need to talk about this topic, and then of course our government is also doing a lot to really address some of these issues, right? Agencies, charities, IPCs like Silver Ribbon that have been working on the ground for all these years have continuing to do the work. So organizations are beginning to see this as
Important.
As important. May not necessarily. Some companies would be a lot more further down the line in terms of prioritizing this. Some of them are probably just taking the initial steps, right? And so they're starting to do things, right? And so what we realize then also again, with all these interviews that we've been doing and all these discussions and discovery that we've been doing at the Wellbeing Champions Network, right? The easiest way for them to start is to organize a talk, on awareness talk or an event or something like that. It's like something like a mental health literacy kind of talk for employees, right? And there's various people who do that, including Silver Ribbon. I mean, they have organized certain talks. You've got other agencies on the ground like Caregivers Alliance and Singapore Association of Mental Health and all these kinds of people. So all these organizations, right? So that's a good place to start, I guess. If you want to start building the baseline in terms of awareness. But the question then is, what happens after that? Does it just remain there? What happens to the attendees of that event? What happens after that? Do they still go back the same? Do they even think about it beyond October, which is supposed to be World Mental Health Day, and everybody wants to do something that day, and you've just basically ticked the box that you've held an event?